Good evening, everyone, and welcome to another one of Simanye Clinic's talks. For this evening, we will be covering mandatory vaccination in the workplace. We have with us Dr. Libeko to facilitate the conversation, and our guest speaker is Advocate Dennis Chamisa. He is an advocate of the High Court of South Africa, Director of Debt Legal and Associates, and also the Director for Student Legal Services. Advocate Chamisa, thank you so much for being with us tonight. And as we kick off, if we could ask the burning questions from our viewers, what does mandatory vaccination mean, and is it legal or is it lawful?
Thank you for that question. There are several fallacious assumptions or mistaken beliefs regarding or behind mandatory vaccination in the workplace, especially in South Africa, given the fact that we started experiencing COVID-19, I think, March 2020. So my take is I hope this discussion will be able to shed more light regarding such an important question. In terms of South African Constitution Act of 1996, I think Section 9, it provides for a provision that every person has got right to equality, right to freedom of religion, belief, and opinion. So such, if you are to apply in the context of vaccination, it weighs a lot because such right also need to be respected. Section 9 is quite clear that one has got right to be equal before the law, right to protection from the law, and to benefit from that law. So given such a reality, I think it is common cause that some employees within the workplace certainly will rely on these constitutional rights to avoid being vaccinated. Such rights are part of South African law. That's why we also have got Equality Act within the workplace. So in the context of mandatory vaccination, allow me to say that though the employees have got rights, for instance, right to freedom of religion, right to belief, right to scientific opinion or any opinion whatsoever, and also there is this other right in terms of Section 12 of the Constitution, which is right to bodily and psychological integrity, so that they're not subjected to any scientific experiment without informed consent. I think informed consent, I think we once discussed this in our previous sessions. It involves giving permission with full knowledge of the consequence of the risk and the benefits of any medical intervention that may be undertaken under any circumstance whatsoever. If I'm to proceed with your permission, can I proceed?
Yes, please, Counsel.
Oh, okay, thank you. So the question may be like employees who are in the workplace who may refuse to be vaccinated, what are their rights? I think it is reasonably expected that some employees will refuse to be vaccinated. That is, I think, expected in any given environment. If an employee of a company refuses to be vaccinated based on any constitutional provisions like right to freedom of religion, right to belief, right to opinion based on the right to equality, or even medical grounds, it is imperative to note that there are certain also risk or possible risk that the employee may use to avoid being vaccinated, such as medical condition. Some may even have side effects from taking such vaccines. So it is imperative for the company, before they impose or implement a mandatory vaccination policy, to provide counseling to such employees in the sense that the employee may seek guidance from a health or safety representative or worker representative or trade union. So they will be guided as to how far they can go about it. So in South Africa, in principle, vaccination can be mandatory. However, there is a framework or guidance under which it can be implemented. So there are certain companies whereby they can, because of what they qualify as a risk assessment, ought to be done first before such a policy can be a reality in any workplace. So in South Africa, based on the Act Occupational Health and Safety and the directive that is also derived from such an act, there is mandatory vaccination policy, but it depends with the company and the circumstances under which that company operates. For instance, let's take an example. A company that works in the health sector, certainly that company is got a right to at least to make sure that its employees are protected, and not only protected from outside, but from inside, because certain employees could be carriers of such. So it is imperative at least to see how best company can assess risk within their work environment or industry. So in this case, I can also give an example whereby the company can also request an employee to do further medical evaluation. For instance, if the employee has got a condition that if vaccinated could cause an employee harm. A company can also conclude that it is imperative or necessary for employees in the workplace to be vaccinated based on a particular or defined circumstances, as I've alluded earlier on. It goes without saying that company will have to be reasonably accommodative to employees in a position that does not require an employee to be vaccinated. What do I mean by this? Not all employees can be forced to be vaccinated. So the policy, we have those who are vaccinated and those who are not vaccinated. An employee may raise various objections for not being vaccinated. Like I alluded earlier on regarding those constitutional rights, right to freedom of religion, right to scientific opinion, or any opinion whatsoever. So they may use such for advocating against vaccination in the workplace. But given such, there is a need for the employer to provide, for instance, if it is a medical, let's assume condition, the employer ought to provide a medical exemption form or a medical personal deferral request form, in the sense that some, for instance, if an employee who is a female, she's pregnant, she may not be expected to take such a vaccine during that time. So that at that time, she may apply for a deferral request form. And there are certain employees that have got a medical condition that may not be, or they don't want to partake in the vaccination. Such are not forced to, but they need to sign that form, and they need to also to have medical support that this is indeed a condition that does exist. And in addition to that, I can also allude to religious beliefs. Anyone can come and say, I can't do this because of a religious belief. Such a belief or denomination or church need to endorse the existence of such a belief so that the company can also take into account of such a category. So in any situation, we have two categories. First category, which I'll qualify as category A, is vaccinated or assumably by now fully vaccinated. Then the other category is not vaccinated. So the employer ought to manage these two groups differently.
Council,
So
if I can
the group
step
that is
in there,
yes.
just to
Yes.
clarify something. So coming
Yes.
back to the Constitution, which you've alluded to earlier. So in terms of the Constitution, then how are we balancing the rights of the employees in terms of mandatory vaccination vis-a-vis the rights and obligations that have been set out by the employer? So how are we balancing those rights? How do we strike a balance between those two?
Yeah, that's a good question to bring forth for this discourse, in the sense that every person can invoke constitutional rights. However, not every right in South Africa is absolute. So in other words, there is no right that is absolute. All rights ought to be measured and tested with the limitation factor, section 36. So if we, for instance, in this case, the rights that we have alluded based on section 9 of the Constitution, right to equality, right to freedom of religion, belief, opinion, or medical condition. So these are certain rights that employees may exercise in the context of the Constitution. However, the employer also has got rights. It's not only the employees that have got rights. The employer also have got rights, in the sense that as an entity, it is a persona in its own right, in the sense that the rights of the employees ought to be weighed in the context of the rights of the employer. In the case that the employer has an obligation to provide a healthy environment and a safety, and healthy and safety environment for its employees, and also third parties outside the entity, which the company may interact with. So in this case, we're looking at the obligation of the employer to provide a healthy and safe environment. Then we're also looking at the employees who have a right to invoke. For instance, I've got a right to religion, I've got a right to scientific opinion. I can't partake this vaccination because of such. So we are weighing these two. Employer can still implement mandatory vaccination, but because of the constitutional rights, that's why we have got two categories. So the employer will try to strike a balance between those who are vaccinated and those who are not vaccinated. In the case that it does not mean that those who are vaccinated, then basically their rights should be sacrificed by those who are not vaccinated. Then those who are vaccinated are supposed to also be regulated in a certain way, just to strike a balance. If you want me to proceed, I may end up adding more information as to what happens to those employees that are exempted from vaccination. What is the criteria, or how is the policy, the mandatory vaccination policy, implemented in the workplace, considering such a group? It goes without saying that for employees that are exempted from mandatory COVID-19 vaccination, the company ought to consider the following. The employees will have to, for instance, have a weekly COVID-19 PCR testing. That's one of the factors that also need to be considered. The employees will need full instruction on how to follow, for instance, the schedule and to fulfill their weekly testing requirement, because it's not part of the policy. So, for instance, if the policy says you are supposed to do a weekly testing, you are supposed to follow certain schedule for testing requirement, and also you are supposed to obtain from HR COVID-19 PCR test before returning to work. Let's say, for instance, one is managed to do inter-city or inter-province travel. There is still need for that testing to be done. This is a group that is not vaccinated. These are employees that are not vaccinated. So in addition to that, they will need to periodically maybe call the call center for clinicians regarding COVID-19, so that at least they are assisted at all times. And like other employees in the workplace, like currently wearing masks all times is still prerequisite. So at the end of the day, these are protective measures that are still implemented even for the employees that are not vaccinated. But the policy is strict more on those who are not vaccinated, so that they protect those who are also vaccinated within the workplace.
So let me ask
I hope I've answered the question.
Yes, I've got a second one, Council. So in terms of the Occupational Health and Safety Directive that was set out last year, I think it was June or July 2021, where they were proposing to actually make vaccination mandatory. In that directive, they actually speak about a specific risk assessment that should be done with employees. So can we go a little bit more into what that risk assessment would entail in order for an employer to actually determine whether an employee should indeed receive the vaccination or whether the employee requires a mandatory vaccination? How do they actually set out who needs it, who doesn't?
Okay, thank you for that question. I think the question that you are asking of it is in the context of Occupational Health and Safety Act of 1993. I think that's where this directive finds its roots. The directive pertaining to occupational health and safety provides that employers must undertake, or employers are obligated to do a risk assessment within the workplace to determine whether vaccination can be made mandatory. So the obligation is upon the employer. The obligation requires the employer to provide a report regarding risk assessment before they implement. They can't just wake up and implement. They ought to do that risk assessment is in terms of Section 8 and 9 of the Occupational Health and Safety Act. It provides that or it requires that employer or the company ought to consider the operational requirements of the workplace. Which factors will affect the employer? If, for instance, the aged group in the workplace, it has to also take into account that there are different age groups. There are those who are vulnerable, maybe to COVID-19, if they're to be infected. How are these to be protected? So assessment goes beyond just looking at isolated factors. It has to look at holistically the operational aspect of the company. In this case, the employer ought to identify employees, like what I'm alluding to, who are classified as high risk due to age, due to medical condition. Some may have underlying illnesses. Such employees need to be also categorized. How many are they? So if there are, for instance, 10 employees in a company of 15 employees in total, which means the operational capacity or requirements of the company will be affected in a negative way if such a group is to be infected. So to take measures in such a, for instance, let's assume this is company A. This company A now, after assessing that most of its employees are vulnerable or are qualified as high risk, it is imperative for them also to now start looking at how they can implement a mandatory vaccination policy in the workplace so that it can protect those who are vulnerable, be it due to medical condition or age. Employees with allergies, they can also be part of the group for a high risk assessment. So at the end of the day, you're looking at various factors that can be considered, but it ought to be on a face value when they look at the assessment, in the sense that a directive does not make vaccination mandatory. That has to be key. So in South Africa, there is a vaccination directive, but it does not make vaccination mandatory. So once the company adopts a policy in the workplace, that becomes a policy for the company, which means it's mandatory now for the company to use that policy for regulation in terms of the conduct of its employees. If, for instance, a group that was not vaccinated and one of the employees does not do the test as required, that is a misconduct already. So the assessment that is required, or this assessment, is to put in place measures that are effective to protect the employees. So from my take, it is necessary for each company to be guided by the Occupational Health and Safety Act in creating an environment that is safe and preventing employees from being exposed, or protect employees also from directly being affected or infected by such a virus. So last but not least, it is imperative for the company to take into account of the constitutional rights of the employees, as I alluded earlier on, in its assessment of the risk, because at the end of the day, you need to consider those two groups which I have created earlier on. Do you still want me to add further to that?
I think that part is clear, Council. Thank you.
Okay.
I see Dr. Libeko has a question. Dr. Libeko?
Yes, thank you very much, Advocate, for such information and informative session. So I've got one or two questions. The first question is, I think I listened in the news a couple of weeks ago where a certain individual, upon refusing taking up a vaccine, was expelled from work or was released from their duties. So I want to hear what your take is on that matter and how such a decision was taken. I don't know if you're aware of that.
Okay, should I answer this one or should I wait for the other question?
We can go for this one first.
Okay, thanks. I think for a company to dismiss an employee in the context of Labor Relations Act, they need to have a policy in existence. For instance, in the context of what we're discussing, or in the context of this discourse, we are saying there ought to be a mandatory COVID-19 vaccination policy in place. So let's assume, like what you are saying, the refusal for an employee to be vaccinated, then it resulted in the dismissal of such an employee. This can only happen in the context of a policy in existence, which the employees are aware of. If there is a breach of that code of conduct, well, the policy becomes code of conduct in the sense that certain employees are now expected to align their conduct in the manner that is provided by the mandatory vaccination policy. If those who are vaccinated are complying with vaccination, that's fine. But those who are not, with reference to your question, the refusal to be vaccinated, there are certain guidelines, there are certain protocols that also need to be followed. If the employee fails to follow such a protocol, that qualifies as misconduct because the policy does exist already. So it is prudent for the employee to make sure that they adhere to the policy, as long as the employer invoke a fair reason, in the sense that there's a policy and the reason is derived from the policy, then becomes a fair reason. And there is evidence of the breach of that policy. And the employee was given opportunity to be heard in a disciplinary hearing. So for it to be a fair dismissal, there ought to be a fair reason. In the context of the policy, it has to be in place. The employee ought to be aware of the policy. The policy ought to be reasonable. So the employer may invoke that the policy is reasonable because I need to protect my other employees. So at the end of the day, the obligation is to make sure that the work environment is safe and everyone is protected from such a virus. So the employer may invoke such a justification. But as long as there is a policy in place and there's a breach of that policy and the employee was aware of that existence of such a policy, then the violation of such a policy or code of conduct would result in one being charged for misconduct and also being called to attend a hearing, which can result in a dismissal. But let me just bring down a scenario. But if the company does not have a policy in place, then it's a different scenario because the company now need to justify why, on what basis they charge the employee, because they need to have a reliant policy whereby they can invoke, we have the code of conduct regarding mandatory vaccination in the workplace, and this is the policy. There was a violation of that policy. If or but for the lack of such a policy, therefore the dismissal can be qualified as unfair because they ought to have evidence of the policy existence, that the employee was aware of it, and the standard was reasonable for the workplace to implement.
Thank you, Council. If I could add on to that, Dr. Libeko, before the next question, if we also look at the Disaster Management Act, I think it's section 27, within that section, they actually say that one needs to implement mandatory safety measures. So if we're looking at mandatory vaccination, we could actually say that it's a mandatory safety measure, and that's one of the reasons why certain employees have to be vaccinated. Another act that one needs to look at when answering this question is the National Health Act. In the National Health Act, it deems medical treatments permissible, but based on policy. And this is the policy that Council has alluded to this evening. And then if we go right back to the beginning of the conversation where we looked at the Occupational Health and Safety Directive, within that risk assessment, they actually say that you have to evaluate the operational requirements of the employee. What are the duties of the employee? And then based on those duties, determine whether that specific employee needs to be vaccinated or not. So with this particular person that was actually let go because they refused mandatory vaccination, they had to have contravened all of the following in order for that progress or process to actually take place.
Yeah, thank you, Dr. Kim, for such input. I think the act that you even referred to, the Disaster Management Act, that one, if we are to look at the literal or grammatical wording of it, it's referring to management of a disaster. So the current situation which we are in now, we are still managing that disaster. It's not yet over. So for such management, it is everyone has to play a part. Companies ought to play a part. Individual ought to play a part. So I think the aim of such, like the act that statutory act that you've referred to, endorses and also support in answering the question that Dr. Madibanya has asked with regard to fairness of dismissal based on refusal to vaccinate.
Okay, Great, thank you very much, Council. So my other question is still a follow-up on what we have just discussed. So how does this mandatory vaccination impact the higher education sector? So I'm asking this because there's certain institutions of universities that have implemented this, and how do students navigate this, and what is the landscape of their rights and all that?
Okay, I think your question is quite important because given the student population, I think if we are to look at it holistically, if an infection is to spread, it will be quite a horrific circumstance. So given the number of students in various institutions, I think the policy still remains the same. The directive, remember the directive applies to any organization, to any company, to any entity. The organization, in this case, qualifies as an academic institution. So in this situation, the leaders or the management of the universities have an obligation to define a policy that students are able to adhere to. So in this scenario, we are only changing the heads of the individual that we're referring to. Earlier on, we're referring to employees because they are working. Now we're referring to students who are studying, but it does not change that we're dealing with a population that requires protection in a certain sector, in a certain industry, in a certain institution. So in this case, still each and every institution is going to obligate. Some institution may define a policy because they can't just implement in a vacuum. They need to implement in the context of a defined policy, which is communicated to the students. Once the students are aware of the existence of such a policy, then basically there are two ways: those who are vaccinated and those who are not vaccinated. In the context of students, still the policy still need to be applied in the context of constitutional provision, because it would be, I think, unfair if their rights are not considered. Some have got genuine rights, some have got medical conditions, some have got right to religion, some have got right to scientific opinion. Such rights cannot be washed or ignored willy-nilly. Such rights also need to be considered. So in the implementation of policy in different universities, it is imperative also to be sensitive to the constitutional imperative regarding right to equality in terms of protection, in terms of benefit from such a mandatory vaccination policy in the institutions. So I take, it is my submission that even in educational institution, such a policy can be applied, but it does not change the principle that we have alluded to, or the principle that we have discussed. The only thing that is changing is the environment under which it's being applied. So the same principles ought to be applied. It has to be done fairly. Those who are not keen to be vaccinated, they need also to periodically go for PCR testing. They need also to be treated differently so that you protect those who are vaccinated. It does not mean those who are refusing to be vaccinated cease to exist as human beings, and those who are vaccinated also need to cease to be. There is need to balance the rights of both students that are vaccinated and those students that are not vaccinated.
Great, thank you very much. So I've got one last statement or question. So while an individual is, has got the freedom to exercise their rights, I've recently picked up on the notion that says that the rights of an individual cannot overweigh those of the community or the nation. Can we expand more on that and provide clarity to the audience at large?
Okay, thank you for that statement. The right of an individual, like what you alluded to, every citizen in South Africa has got a right based on the Constitution, which means every person has got a right to invoke any constitutional provision that I have a right to freedom of religion, I have a right to scientific opinion, I have a right to this and that. Let's put a scenario. We have got millions of people in South Africa. These million people are exposed. The lockdown that happened was in the context of the population. How can we protect the population? And not how can you protect a certain individual, but how can you protect the general population from this pandemic? Because this pandemic can affect, and when it does affect, it has a negative impact economically, socially, and politically. So at the end of the day, it is imperative to weigh the option, like what you're alluding to. Not every right is absolute. So the fact that we have got, I can give an example of the policy that was implemented in the context of disaster management, whereby the directives was the prohibition of cigarettes. Such was intended to protect those who smoke, in the sense that if they are to be infected with such a virus, then basically they may have a negative impact. They what call it? The effect may have a negative impact to the hospitals. So at the end of the day, it may push or pressure, it may pile pressure regarding the hospitals and the management of the influx of such. So at the end of the day, you're looking at individuals that may have certain rights, but their rights also need to be looked at holistically in the context of public policy. Public policy detects that we need to ensure that everybody is wearing a mask. Everybody has got a responsibility to ensure that we contain the spread of such a virus. So individual rights are always looked at, but there is a limiting factor in the sense not every right that any person can invoke is absolute. It has to be weighed with other rights of other individuals. The right to health, the right to safe environment, such is also a limiting factor of certain individuals' rights. So at the end of the day, yes, one may invoke a right, but it has to be weighed. There is a limiting factor which each and every right that can be invoked in South African Constitution.
Thank you so much, Council. Are there any other questions from the audience? We have 5 more minutes before closing. I see that Dr. Five is actually online. Dr. Five is one of the doctors that are involved with doing vaccinations on a large scale for a variety of different companies. Dr. Five, do you have any comments in this regard with respect to mandatory vaccination? I think he's probably having a problem with his reception because he's not unmuted. Are there any other comments from anybody else in the audience? It seems like there's
I wanted to just
yes.
Okay,
yes,
I wanted to just add one more thing, just maybe in conclusion. Because normally it happens, I think I was facing or coming across this question oftentimes, whereby new recruits or new appointments, whether they are subjected to such or are they required to go through such mandatory vaccination before they're employed. I think I was exposed to such a question many a times. My response to such is, if the company adopted a policy, mandatory vaccination policy in the workplace, then it also means new recruits, before they are hired, they also need to agree that they will adhere to the policy. If they agree not to adhere, like for instance, they are not going to comply with the vaccination requirements, then they can either be classified as those who are not vaccinated and they need to follow a certain procedure or protocol. So at the end of the day, the employer has got a discretion regarding potential candidates, and because they need to be notified prior to coming for the interview or prior to the employment that there is a policy that exists, and this is the condition or terms and conditions of such a policy. So when they are part and parcel of the company, they are well informed of such a policy and its existence. That's one thing that I wanted to add to.
I see Dr. Five has made a comment, Council. He's referring to restriction issues, but I'm not sure if those restrictions refer to the policy in themselves. Is there one uniform policy that we're currently using for mandatory vaccination?
Come again?
I see Dr. Five has made a comment and he says he's having issues with regards to restrictions. So I'm not sure if that's in terms of the policy space. So I wanted to find out, is there one policy that's being implemented broadly in terms of mandatory vaccination, or is each company creating their own policy and each university utilizing their own policies?
Okay, I think regarding such a question, there are certain guidelines which are provided for implementation of mandatory COVID-19 vaccination policy. The implementation guidelines is also supported by an implementation procedure that also need to be adhered to. So in terms of the policy, there is a policy, but there is a standard that ought to be applied across board with a reference to guidelines and with a reference to implementation procedure of such a policy. Because if we have got different guidelines or implementation, then that will actually result in chaos in terms of which standard are you going to be able to invoke if there's a dispute? Which standard are you going to be able to rely upon to find a resolution between the parties, be it at workplace or otherwise? So at the end of the day, there is a standard that is provided for in terms of the guidelines. There's a standard that is provided for in terms of the implementation procedure by either employers or in any environment like what Dr. Madibanya say, even academic institution. So such ought to be standardized for consistency.
Thank you so much, Council, and thank you so much to the audience for being here this evening. If there are any other questions that you'd like to pose to us, please feel free to contact either of us on Facebook, on the Simanye Facebook page, or via email. Thank you, everyone. Have a wonderful evening further. Goodbye for now.
Okay, thank you.